You did mentioned community health choices several times this morning, but there's also a life program that I understand might be less expensive than the community health choices. So can you tell me, are all the consumers in the life program eligible for nursing home services?
Consumers in the life program are handpicked, and so they're not in nursing facilities. They have to be able to safely
They're eligible,
live.
though.
They're eligible, yes.
They're eligible. So can you tell me, like, what is the average cost of a recipient in life, and then what is the average or the monthly cost, I guess, of a recipient in community health choices? You know, like, what's the difference in the cost for those two?
I think your question kind of assumes that we're comparing apples and apples, and we're really not, because the population served by CHC is different in terms of the services that CHC has to provide. So in their rates, they have to provide whatever services are needed. So, and it doesn't have to be people who can live safely in the community. They're providing nursing facility services that, of course, are much more expensive than community-based services. So you can't really compare life rates with CHC rates. And only about 10% of our life.
But I thought the life program had the same one, just maybe a difference as far as the age difference. But I thought they offered the same services.
They're not covering people who are in a nursing facility where that care is much more expensive. That's where CHC has to cover that care. The life program is not covering that care.
Okay, but if they need care in a nursing home, they get that same care through life. Life will provide that. If they get to that point where they need nursing home services, Life provides that.
Except that Life can basically turn anyone down initially if they don't think they can safely live in the community. So again, it is apples and oranges. We're not really comparing the same thing.
And so who's giving the consumer that choice, right? So does the department make sure that people know? So if I'm out looking for someone, or I said I'm at that age where my kids are probably going to be looking for me soon, right? So who's going to give them the choice to say this service is available through community services or this is available through Life? Like, how are they going to know that they have an option?
We've actually been doing a lot of advertising for Life. We think Life is a great program for people who are eligible. So as we've been out there talking about CHC, we've done a lot to promote Life alongside it and to let people know that that's an option. And I think when you look at the enrollments, we continue to see the Life program grow. And I think that's a result of the fact that we've been doing so much to put Life out there as an option for people. We're also doing a pilot program to have our enrollment broker talk about Life as an option. So going forward, that might be something we also look at.
Who chose to go to Life? So in the different zones?
Who chose to go to Life?
As you're implementing it, right? So who chose, like, how do you?
I'm not sure I understand the question.
So how many people are choosing Life as an alternative over the community? Like, do you have a number of people that have chose that?
Well, I can tell you what the enrollments look like in terms of the Life program. So in 1920, we've seen 7,281 people enroll in Life, and in 1819 we had 6761. So we saw a 7% increase in the Life enrollment in 1920, a 5.9% increase in 1819, a 6.7% increase in 1718. So the Life program, as I said, continues to grow even as we roll out CHC.
Well, I think one of the things I had heard in the past, like when here's the community health choices, and then here's a little box that gives you Life, right? That explains Life. So are there the ratepayers the same? Are they getting reimbursed the same amount? The providers?
So our managed care organizations negotiate rates with the providers. The Life program is providing all the services. So we're paying Life, and then Life is providing the services.
Okay, but so are we getting a better bang for our dollar with Life under the services they provide? Are they getting reimbursed the same?
again, I mean, you're really comparing apples and oranges. So the Life program is a great option for people who do qualify for it and who can get into Life, but only about 10% of our CHC population is eligible for Life. So you mentioned we talk about CHC, and then over here, we always talk about Life, but again, we have to remember only 10% of that population is even eligible for Life.
But I think if you're that 10%, you want to make sure you have that choice and that option.
Which is why we've been talking about it so much and why I think you see the enrollment growing.